"60 seconds. It's not a lot of time. But what if I told you there was a disease that killed a child every 60 seconds? And what if I told you this disease was entirely preventable?"
Malaria is a massive killer. Not just killing, but killing especially the more vulnerable, children, pregnant women. The sheer number of deaths, now down to only 1 every 60 seconds, is unimaginable.
It's shocking to know that every 60 seconds a child dies of a disease that's treatable and preventable. And if that were in the United States, we would take care of that problem in 2 to 3 weeks. But because it's in Africa, it's easy to turn our backs to the problem and to not implement the change that's needed.
It's very sad because especially children, they're dying from something that is 100% preventable and treatable. So it's very absurd that, such a large number of children are continuing to die even as we talk right now.
In 2010, over 1.2 million people died from malaria. Over 700,000 of those happened in Africa. And in some countries in Africa, 1 out of every 20 children will die from malaria by the time they are 5 years old. What is most shocking is that this deadly disease is caused by a mosquito.
A mosquito, if it bites someone that is already infected and it bites you also, it will carry those germs into your body. So something as small as an insect, as a bag, as a mosquito can be that dangerous to people, to a very large population of people. It's quite absurd.
In Africa, it seems to be the situation we have a lack of mosquito control and various methods to stop mosquitoes, such things as just simply putting nets above beds and things like this, have had a dramatic effect in reducing the amount of malaria cases, and it could be a physical barrier to block further transmissions. But in general, it tends to be in areas where there's particular mosquito species as well as a lack of controlled mosquito populations.
Malaria is an entirely preventable disease. The problem is that some people in the remote and impoverished areas in Africa do not have the access to the medication they need.
But the people in sub-Saharan Africa don't have the money to pay for the treatment, or they don't have the transportation to get to the doctor. In some cases, you're looking at a family that has a sick child and they have to choose between being able to feed the healthy kids or get medicine for the sick kids. Here you have some of the best land in the world, and yet the people are going hungry. Why? In large part because of malaria. There is poverty because of malaria, and because of malaria, there's poverty.
Every district has a referral hospital that is like the largest health facility in the area, but the problem is that in the rural areas, it's very difficult transportation-wise to get sick people from the very remote areas to where the big hospitals are.
The numbers of actual deaths and cases of malaria is probably underestimated to a certain degree as well, because you just do not have the facilities, the record keeping, the medical outreach that's present in these developing countries.
Malaria is spread through a mosquito bite. When an infected mosquito bites someone, they infect that person with a malaria parasite. Any mosquito that bites that person becomes infected, causing a spiral of disease that has the potential to kill millions. The living conditions in parts of Africa are perfect for the spread of this disease. Wetlands attract mosquitoes, making these open areas of Africa extremely dangerous.
There is more malaria in rural areas than there is in urban areas, because in the urban areas there is buildings everywhere. There's no chance for vegetation to grow.
It is endemic to regions where you have particular strains of mosquitoes that carry the malaria parasite. And actually, when the country was founded, malaria was present in the United States. And through an eradication program to rid mosquitoes, the subsequent effect was there was a reduction and abolishment of malaria in the United States.
We have eradicated malaria from large parts of the world. The places where malaria persists are not places where there's just more of it, though the climate's more suitable, to be sure. It's places we have not yet had the will to save the lives.
You have a fever, chills, body aches, kind of like having the flu here in the States. And then it progresses to become more severe. So then you start having spinal problems, brain problems, problems with your blood circulating properly, and then that's eventually when somebody obviously gets so sick that they die.
I really got relatively sick a couple of times. I remember coming back to school and I felt so tired, like I just started throwing up. That drastic change in temperature, increase in temperature, and my parents took me to the hospital, and the doctor took my temperature and they drew blood, and I had malaria parasites, so they started me on medication straight away. I wouldn't really wish anyone to have malaria. It's painful, and it drains you as a person. It weakens you. You're constantly passing out stool. You're vomiting, so you're losing a lot of water and energy at the same time. The bad thing with malaria is that once you catch it, you have to stay rehydrated. Otherwise, your body becomes so dehydrated that you become so weak, and that gives opportunities to other diseases to catch on. Well treated, feeding well, give it 5-7 days, you should be better. But sometimes in rural areas, again, or people that do not really have access to good medication, it can take longer than that and eventually turn fatal.
Despite the rate that children are dying from this disease, there is hope. Progress is being made. In the year 2000, nearly 1.6 million people around the world died from malaria. That number peaked in 2004 at over 1.8 million. Only 6 years later, in 2010, the number of deaths dropped by an astounding 600,000 people.
It was every 30 seconds. And then last year it was every 45 seconds, and now it's every 60 seconds. So that's a great thing that they're making progress and that children are dying less frequently, but it's still obviously a really, really bad thing when a child dies of a disease every 60 seconds.
People are fighting malaria every single day. Buying bed nets and medication for people around the world who can't afford it themselves has been a major factor in eradicating malaria from the face of the earth. Nonprofit organizations like Against Malaria and World Vision, along with all kinds of religious groups like the ELCA Malaria Campaign, are making it their goal to save the lives of millions of people.
It's great work, it's phenomenal work that a group would take off their precious time to just raise awareness, which is very, very important, raising awareness, but going above and beyond and raising funds for a cause that does not even affect them here, and being able to help people elsewhere. It's beautiful work, it's amazing work.
We all have the ability to do something to make a difference, and I think that people are understanding that it's just unacceptable that there's a disease that's killing this many people. They've accepted the fact that their children are going to die from this disease, which I think is shocking for a lot of us.
People will say to me, I want my life to make a difference. I want to be the change. This is how you can do it. With $10, you can save the children in a household. You can provide medicine to people who would otherwise die. If what you want to do is live an important life where you are changing a whole village, and bringing life to a community, restoring economies, this is how you can do it. This is the change.
People in Africa and all around the world are in need of help. With a child dying from malaria every 60 seconds, there's no time to waste. These are 60 seconds to make a difference. 60 seconds to save a life. 60 seconds to change.